His hands were shaking more than mine, which, considering I was the one holding the needle, was saying something. It was a late autumn evening, the kind where the sky turns that particular shade of pewter that makes everything feel a little cinematic, a little borrowed from someone else's life. I was doing a house call, which, I know, sounds impossibly old-fashioned, like I should be arriving in a horse-drawn carriage with a black bag and a serious expression. But my neighbor's husband had called in a mild panic, his voice doing that specific thing men's voices do when they're trying very hard to sound calm and absolutely failing. His wife needed her injection. Their regular nurse was stuck 2 towns over in traffic that had apparently stopped moving sometime around noon and wasn't planning to start again. So here I was. Their apartment smelled like cinnamon and old books. The good kind of old, not the damp kind. Bookshelves floor to ceiling, a cat asleep on a radiator, a lamp throwing honey-colored light across everything. His name was Daniel, late 40s, maybe early 50s, the kind of face that looks like it's spent a lot of time outdoors and a lot of time laughing. He met me at the door holding a cup of tea he'd clearly made for himself and then forgotten about entirely. "She's in the bedroom," he said. She's fine, I'm not great with needles." I looked at him. "You're not the one getting the injection." "I know." He said it with such sincere misery that I almost laughed. His wife, Margaret, was sitting up in bed with reading glasses on her nose and a paperback open in her lap, looking like someone who had absolutely no intention of being dramatic about any of this. She was in her mid-60s, silver-haired, with the kind of sharp eyes that made you feel like she was quietly grading you. "Finally," she said, not unkindly, just efficiently. She had rheumatoid arthritis, and her doctor had her on a biologic medication, the kind that comes in a pre-filled syringe and needs to go into subcutaneous tissue, just under the skin, not deep into muscle. Different from an intramuscular injection, but the principle of calm is the same. The needle is smaller, the technique is gentler, but the anxiety? Somehow always identical. I sat on the edge of the bed. She gestured for me to, so I did. And I opened my bag and started laying things out in a quiet, unhurried way. I've learned that the ritual of preparation does half the work. When you move slowly and deliberately, when you don't rush, when you let the patient watch you organize everything, the alcohol swab, the gloves, the syringe, something in them starts to relax. They can see there's a sequence, a logic. It's not going to be chaos. "Have you eaten today?" I asked her, pulling on my gloves. "I had breakfast and a very mediocre sandwich at noon," she said. "Good. Any redness or swelling at the last injection site?" "Left thigh, last time. Healed perfectly." I nodded. "We'd do the abdomen today then. Rotating sites matters more than most people realize. If you inject into the same spot repeatedly, the tissue gets irritated, hardens a little, and the medication stops absorbing as efficiently. Rotation isn't just a suggestion. It's the whole point." Daniel had positioned himself in the doorway, close enough to be present, far enough to pretend he wasn't watching. "You can come in," Margaret said to him, without looking up from where she was watching my hands. "I'm fine here," he said. "You're hovering." "I'm supporting." She looked at me over her reading glasses. 26 years, she said, as if that explained everything. It did. I warmed the syringe between my palms for a moment. This is something people skip and shouldn't. Cold medication stings. It's a small thing, 30 seconds of warmth between your hands, but it changes the experience completely. The patient feels it. They notice, and that noticing shifts something. It tells them you thought about their comfort before you thought about efficiency. Okay, I said. I'm going to clean the skin now. Small pinch of cold. The alcohol swab is always a little startling if you don't warn them. I let it dry, fully dry, not just a quick wave, because injecting through wet alcohol can sting and, in theory, introduce irritation. 10 seconds of patience. That's all it costs. Take a slow breath for me, I said. She did. I pinched the skin gently. For subcutaneous injections, you lift the tissue slightly away from the muscle beneath, creating a small, soft fold. The needle goes in at about a 45-degree angle, smooth and steady. Not fast, not jabbing, just a continuous, confident movement. Hesitation is what creates pain. The needle that goes in with one clean intention hurts far less than the one that second-guesses itself halfway through. She didn't flinch. Done, I said. She blinked. That's it? That's it. From the doorway, Daniel let out a breath he'd been holding for what sounded like several minutes. You're ridiculous, Margaret told him with tremendous affection. I held gentle pressure on the site. No rubbing, just light, steady contact for a few seconds. Rubbing can cause the medication to disperse unevenly, and with biologics especially, you want it to absorb where you put it. Any dizziness? Anything feel off? I asked. I feel exactly as I did 3 minutes ago, she said, which is to say, fine. I smiled and started putting things away. Daniel came in then, properly, and sat in the chair by the window. The cat had migrated from the radiator to the foot of the bed at some point during all of this, and was now regarding me with the particular suspicion cats reserve for guests who don't immediately offer their hand to be sniffed. Can I ask you something? Daniel said. Of course. Does it ever... He stopped. Tried again. Does it bother you, hurting people even a little, even when it's necessary? I thought about that. I thought about it honestly, the way the question deserved. It used to, I said. Early on, I'd apologize before I'd even done anything. I'd say sorry and the patient would get nervous because they thought they should be bracing for something terrible. I paused. Now I think the small hurt is in service of something. It's not cruelty, it's care with a cost. And if I'm doing it right, the cost is as small as I can possibly make it. He nodded slowly. Besides, I added, your hands were shaking more than mine. He laughed, a real one, surprised out of him. Margaret looked at me with those sharp, grating eyes, and I had the distinct feeling I'd just passed something. Before I left, she stopped me at the door. One more thing, she said. He's been running a low fever since yesterday evening. Nothing alarming, just that flat, persistent warmth. Should I worry? Low-grade fever, under 101 Fahrenheit, in an otherwise stable adult, usually means the body is doing exactly what it's supposed to, mounting a response to something minor. The things to watch are duration and direction. If it climbs, if it's still there after 2 full days, if it comes with a stiff neck or a rash or difficulty breathing, then you call a doctor, not a neighbor. But a mild fever that's behaving itself in someone who's eating and drinking and not looking gray, that's just the body working. Keep him hydrated, I said. Watch the trend, not just the number. If it's still there the day after tomorrow, have him seen. She nodded, filed it away. I had the sense she filed everything away. I walked back through the cinnamon and books apartment, past the sleeping cat, past the lamp still pouring honey light across the bookshelves. Daniel held the door open for me. "Thank you," he said, quietly, like he meant it for more than just the injection.